HIE causes permanent damage to the central nervous system cells and may result in neonatal death or manifest itself as cerebral palsy. So 10 to 20% of children with CP have that because they had HIE. It can also manifest as mental deficiency, blindness, hearing deficiency, and epilepsy in children. The incidence of this in America is 1 to 8 cases per 1,000 births in the United States. 15 to 20% of infants with HIE die in the neonatal period, so most infants that don't survive this die within the first week after they're born. And then 25 to 30% of the survivors are going to develop permanent neurodevelopmental abnormalities. In order to prevent this from happening, early intervention has been shown to decrease the cerebral injury and prevent some of the complications. So the two things that they really do are symptomatic oxygen, which is also known as artificial respiration, and then they have to treat or surgically correct the multi-organ system dysfunction that's occurring all over the place. HIE continues to be a major cause of neonatal morbidity and mortality, both in the United States and around the world. Perinatal HIE can be divided into 3 stages of severity that have predictable outcomes. However, unfortunately, these stages can only be assigned after the HIE is established, and no intervention can really change the outcome at that point. So the 3 stages are mild, moderate, and severe. The mild cases present with increased muscle tone and deep tendon reflexes, and these cases can fully recover in 3 to 4 days. The symptoms are, like the name suggests, pretty mild, and these children are really going to be long-term just fine. The moderate cases are going to present with the opposite, so decreased muscle tone and deep tendon reflexes, as well as some absent reflexes and seizures. These children can fully recover within 1 to 2 weeks. However, it's very important to keep in mind that this secondary deficiency can occur and they can rapidly deteriorate. So you really have to keep a close eye on moderate and severe cases. And the severe cases present with a child in a stupor or coma, hypotonia, decreased deep tendon reflexes, absent reflexes, nystagmus, seizures, and irregularities with the cardiovascular system. And these are mostly the cases that are going to result in some severe developmental deficiencies or death. So there are several different causes for HIE. There are prepartum causes, which are prior to birth, and these risk factors include insulin-dependent type 2 diabetes in the mother, thyroid disease, fertility treatments, or advanced maternal age. In the antepartum stage, which is not long before birth, severe preeclampsia, placental abruption, multiples, antepartum hemorrhage, or intrauterine growth restriction. In the intrapartum phase, which is the during birth phase, if the child is born breech, if there's cord prolapse, a stat C-section, induction of labor, or maternal pyrexia or fever, these are the risk factors. And then 10% of cases of HIE occur postnatally, so after birth. And that's what I have on HIE. Like I said, if you have any questions, don't hesitate to give me a call, and I'll try and answer them as best I can. Have a nice day. I wish I could be with you guys. Bye.